Global Alliance for Infections in Surgery. Best practice in managing infections in surgery. Antimicrobial resistance is a public health crisis of international concern, threatening modern medicine, animal health, and food security. The global nature of AMR calls for a global response. The impact of AMR worldwide is significant both in economic terms and patient outcomes, as it may lead to some infections becoming treatable or requiring antimicrobials of last resort when the treatment is mandatory, and increased length of hospital stay, morbidity, mortality, and treatment cost. Combating resistance has become a top priority for global policymakers and public health authorities. New mechanisms of resistance continue to emerge and spread globally, threatening our ability to treat common infections. Antibacterial and antifungal use in animal and agricultural industries aggravates selective pressure on microbes. A One Health approach is urgently required. Also, healthcare workers play a central role in preventing the emergence and spread of resistance. At the 68th World Health Assembly in May 2015, the World Health Organization endorsed a global action plan to tackle antimicrobial resistance. It sets out 5 strategic objectives: to improve awareness and understanding of antimicrobial resistance, to strengthen knowledge through surveillance and research, to reduce the incidence of infection, to optimize the use of antimicrobial agents, and to develop the economic case for sustainable investment that takes account of the needs of all countries and increase investment in new medicines, diagnostic tools, vaccines, and other interventions. Appropriate use of antibiotics and compliance with infection prevention and control measures should be integral to good clinical practice and standards of care. However, both infection prevention and control measures and appropriate antibiotic prescribing practices are often inadequate, and a great gap exists between the best evidence and clinical practice across the surgical pathway. In line with a One Health approach, raising awareness of AMR by education and dissemination of information to stakeholders is an important factor in changing behaviors. Correct approach to infections in surgery. Infection prevention and control. Antimicrobial stewardship. Correct surgical technique. That is best practice. Infection prevention and control. Prevention is better than cure. Healthcare associated infections. Surgical site infections. Catheter acquired urinary infections. Hospital acquired pneumonia, and central venous catheter-related bloodstream infections. Healthcare-associated infections can develop either as a direct result of healthcare intervention or from being in contact with a healthcare setting. Patients with a healthcare-associated infection are more likely to have higher mortality, a longer hospital stay, require broader spectrum antibiotics, and place greater demands on the health system. The application of appropriate infection prevention and control strategies by the healthcare workers can reduce the risk of them, as most of them are preventable. Prevention of surgical site infections. Recent guidelines. Global guidelines for the prevention of surgical site infections. Centers for Disease Control and Prevention Guideline for the Prevention of Surgical Site Infection. Five bundles for the prevention of surgical site infections worldwide. Preoperative bathing or showering, appropriate surgical antibiotic prophylaxis, no hair removal, correct surgical hand scrub or preparation, and correct skin antiseptic preparation. Clean your hands before touching a patient, before clean aseptic procedures, after body fluid exposure or risk, after touching a patient, and after touching patient surroundings. Antibiotic prescribing practice. Antibiotics can be life-saving when treating bacterial infections, but are often used inappropriately. Large variations in antibiotic consumption exist between countries, and whilst excessive use remains a major problem in some areas of the world, elsewhere there is lack of access to many antimicrobial agents. Antimicrobial resistance is a natural phenomenon that occurs as microbes evolve. However, misuse of antibiotics has accelerated the development and dissemination of resistance. Why appropriate use of antibiotics is important: to limit antimicrobial resistance, to decrease Clostridium difficile infections, to improve patients' outcome, to decrease adverse antibiotic events, and to reduce healthcare costs. Antimicrobial stewardship. Hospitals play a crucial role in the containment of antimicrobial resistance. Hospital-based antibiotic stewardship programs can help clinicians to optimize the treatment of infections and to reduce adverse events. All acute care hospitals should implement antibiotic stewardship programs. We believe in an interdisciplinary approach to infections in surgery, made up of clinical pharmacologists, hospital pharmacists, epidemiologists, hospital administrator, infection control specialist, infectious diseases specialist, microbiologist, nurse, anesthesiologist, intensivist, and surgeon. Antibiotics in surgery. Prophylaxis, antibiotics to prevent infections. Empiric therapy, antibiotics to treat clinically suspected infections. Targeted therapy, antibiotics to treat bacteriologically confirmed infections. Best practices to combat antimicrobial resistance in surgery. Follow locally developed antibiotic guidelines and clinical pathways. Enhance infection prevention and control. Control the source of infection. Prescribe antibiotics only when they are truly required. Prescribe appropriate antibiotics with adequate dosages. Reassess treatment when culture results are available. Use the shortest duration of antibiotics based on evidence. Educate staff and support surveillance of antibiotic resistance and antibiotic consumption. Enhance infection prevention and control. Prescribe antibiotics when they're truly needed. Use antibiotics appropriately. Control the source of infection when it is needed. Together, we can impact millions of people. Why the Global Alliance for Infections in Surgery? Our aim is to promote global standards in the management of infections across the surgical pathway by a global dialogue on what is the most appropriate way for their prevention and treatment. Join us in this dream. Thank you for your kind attention.